Sorry about that. Welcome to HVIO's webinar on connections between income and health. All attendees will be in listen-only mode throughout the webinar. Please type questions into the question box from your GoToWebinar control panel. Just so you know, slides are in a recording of this webinar will be posted on our website, hpio.net, within a couple of days. And at the end of the webinar, we'll have a poll question and a survey will also be mailed out to you later today, kind of getting your feedback on how the webinar went. We'd really like to see you participate so that we could keep continually improving our webinar series. We're grateful for participation from a couple of guest speakers today. Michael Evans from the Governor's Office of Workforce Transformation, Kalitha Williams from the Policy Matters Ohio, Greg Lawson from the Buckeye Institute. And we're going to start things off with HPIO Health Policy Analyst Zach Reat, who will be presenting an overview of the connections between income and health. So as I mentioned, Zach was going to start things off with a kind of an overview of our publication and the issue of the relationship between income and health. After that, we're going to have our panelists kind of join in to talk about how income influences health and conversely how health influences income and factors that impact both income and health. Briefly, before we start, I wanted to give a little bit of background about HPIO for those that are not as familiar with our organization. We were founded in 2003 by a group of core funders. Here's a list of our current funders. Many of those are the original funders plus some additional. The vision and mission of HPIO is to influence and improve the health and well-being for all Ohioans. Our primary audience for our work is state policymakers. And with that little bit of background, I want to pass it off to Zach.
Thank you, Nick. And before I get into sharing some of the information from the brief, I want to place it in the context of some of the other work that the Health Policy Institute has done recently. So over the last couple of years, the Health Policy Institute of Ohio has released an overview brief as well as a series of fact sheets about the connections between education and health. We've also released the brief about connections between income and health that we're going to be talking more about today. And then finally, we prepared a report for the Legislative Services Commission on connections between social determinants of health and infant mortality. And we do this work at HPIO because we know that Ohioans are less healthy than many people living in other states, and that access to healthcare services does not fully explain this difference. For those of you who are not familiar with HPIO's Health Value Dashboard, it's a tool that is published biennially to track Ohio's progress towards health value, which is a composite measure of Ohio's performance on population health outcomes and healthcare spending. In the 2017 edition of the dashboard, Ohio ranked 46th out of 50 states and the District of Columbia. And this means that Ohioans are living less healthy lives and they're spending more on healthcare than people in most other states. So why is it that Ohio ranks so poorly? Well, research indicates that health is impacted by a number of modifiable factors, and that clinical care accounts for only about 20%. In 2017, Ohio performed well on access to care, but did poorly on population health and other factors that impact overall health value. This indicates to us that access to healthcare is necessary. In fact, it's critical for those who are sick or injured, but it's not sufficient to improving the overall health of Ohioans. So to focus more on income, the 2017 dashboard ranked Ohio number 29 on outcomes related to the social and economic environment. And those include metrics like unemployment, poverty, labor force participation, and income inequality. Ohio's unemployment rate is now at the lowest rate it's been in at the past decade, or excuse me, it's near the lowest rate it's been at in the past decade. But the median income for Ohioans has lagged behind the US for the last 13 years. And in 2016, Ohio's median income was over $5,000 less than the median income for the United States. This graphic was prepared for the report that I previously mentioned about connections between infant mortality and social determinants of health. And it illustrates that a smaller proportion of white Ohioans have low incomes or incomes below 200% of the poverty level than do Black Ohioans. In 2016, 48% of Black Ohioans had incomes below 200% of the federal poverty level, compared to just 27% of white Ohioans. Incomes are distributed throughout the state of Ohio as well. And some counties and regions in the state have higher rates of poverty than others. So this map is from 2015. And in that year, nearly 1/3 of Ohioans had incomes below 200% of the federal poverty, and almost 2/3 had incomes below 400% of the federal poverty. And then as you can see, in Ohio, households with low incomes are generally concentrated in the southern and eastern regions of the state. So now we'll look at some of the health-related incomes separated out by income level. So in Ohio, there are large disparities in health outcomes that are experienced by people with low incomes as compared to those with higher incomes. In general, people with higher incomes tend to live longer and healthier lives than people with lower incomes. And then people with the very lowest incomes experience the very worst health outcomes. Since implementation of the Affordable Care Act's coverage provisions in 2014, which included Medicaid expansion, the uninsured rate has dropped significantly among Ohioans with incomes below 138%. However, a large disparity still exists in health insurance coverage rates between those with high incomes and those with lower incomes. So in 2016, Ohioans with low incomes were almost 5 times as likely to be uninsured as those with higher incomes. In addition to the disparities that we observe when we look at health outcomes by income, there can also be a double burden on health from disparities and inequities. And this is because groups with low incomes are also those that often experience poorer health outcomes. So for example, African American or Black Ohioans are more likely to have low incomes, and they're more likely to experience poor health outcomes. When people are a part of more than one group that experiences health disparities, the underlying causes of those disparities tend to place a double burden on the health of the individual. So for example, racial and ethnic minorities that live with disabilities tend to experience worse health outcomes than white people that live with disabilities. So now we'll talk about some of the pathways by which income influences health. And this is by no means an exhaustive list of what's out there in the research literature. But our publication highlighted how income influences health behaviors, access to healthcare, and stress and hazards in the workplace. Factors related to the social and economic environment, including income, can have a strong influence on health behaviors. Let's take food choice, for example. People with low incomes often work multiple part-time jobs or jobs with irregular schedules. They may encounter difficulties with childcare or experience a lack of reliable transportation. All of these things can also make it harder for people with low incomes to eat a healthy diet, cook home-prepared meals, or get to the grocery store to buy fresh produce. Those things are typically more easier for people with higher incomes to deal with because they have additional financial and other resources to address life problems like that when they arise. In addition, excuse me, let me switch my slide here. In addition, the research shows that unhealthy foods, which do tend to be more filling but lower in nutritional value, are less expensive than healthier foods, but they're also easier to find in low-income neighborhoods. And what we have here is an example of an evidence-based strategy to increase access to healthy foods by bringing healthy foods into convenience stores. So we see a picture of the situation before where we had candy and other low nutritional value foods at the checkout, and then on the right, healthier food choices, snack choices. In terms of access to healthcare, people with low incomes are more likely to be uninsured and also to have unmet healthcare needs. In addition to the disparities in health insurance coverage rates that I already mentioned, research shows that there are typically fewer healthcare facilities in low-income neighborhoods, and this makes it more difficult for people in those areas to access care, particularly people who face problems with transportation. Finally, the stress related to low-wage work can negatively affect many health outcomes. So in general, when it comes to employment, jobs that pay a living wage, offer flexibility to address life's challenges, and give employees more of a sense of control over their work tend to promote better physical and mental health outcomes. And in contrast, jobs that pay low wages, they typically come with less flexibility or control over work. For example, in 2017, about 46% of low-wage workers had paid sick leave, compared to about 91% of high-wage workers. Now, research on the connections between income and health mostly focuses on pathways by which income influences health. But economists and some other researchers also explore the reverse causality, or in other words, how income or how health impacts income. Two common topics in the research literature about health's influence on income, two common topics in the research literature related to health's impact on absenteeism and disability are, so in general, the effects of health on income are more severe for people with low incomes because they typically have fewer resources, including, as I mentioned, health insurance coverage or savings or paid time off work to reduce the negative impact of poor health on income. And when health problems cause absenteeism from work or school, it can have both short and long-term impacts on income. This can happen through reduced hours, reduced productivity, or lower educational attainment. A 2011 analysis found that workers with 2 or 3 chronic conditions miss 3 or more days of work per year on average than people with no chronic conditions. And people with 4 or more chronic conditions miss 9 more days of work on average. People with more chronic conditions are also less likely to be employed. So again, in 2011, about 82% of US adults without chronic conditions, and that's working age adults, were employed. And that's compared to just 39% of individuals with 4 or more chronic conditions. Temporary or permanent disability can also impact income for working adults, and this can happen again through job loss or reduction in hours, changing work duties, or limiting access to opportunities for improvement like education or even opportunities for promotion at work. In addition, the Federal Social Security Disability Insurance Program, which pays benefits to workers who become disabled, pays benefits based on earnings history. And this means that people who earn low wages throughout their working career will also receive low wages from the disability program if and when they become disabled. So now we'll focus on some of the factors that can impact both incomes and health outcomes. So there's a large and growing body of evidence that looks at connections between institutional, structural, and interpersonal racism and the health and the incomes of minority populations, particularly African American and Hispanic populations. So for example, residential segregation is associated with an increased risk of poor birth outcomes and higher infant mortality. And discrimination has also been shown to negatively impact a number of health-related outcomes. And this is likely related to the stress that's associated with being discriminated against or having feelings of inferiority. Discrimination also contributes to persistent wage and employment disparities that are experienced by minority groups. And studies have confirmed that it's discrimination, not personal characteristics, that are driving these wage disparities. They've done that in studies by controlling for personal characteristics such as educational attainment. For example, when comparing male college graduates in 2014, Black men experienced a 20% wage disparity compared to white college graduates. And overall, as you see on the graph, the median income for Black households was more than $23,000 less than the median income for white households in 2015. Sorry, I clicked ahead of myself there. Housing and neighborhood conditions can also impact health through exposure to harmful conditions, and those exposures can happen both in the home, such as lead or other allergens, but it can also happen in the surrounding neighborhood, exposures to things such as violent crimes or unsafe sidewalks or bus stops. Housing can affect income primarily because it's the largest expense in most household budgets. And there's also a shortage of affordable housing in most parts of Ohio, particularly for low-income families. And the result of this is that many Ohioans with low incomes pay too much each month for housing costs, and this simply leaves less at the end of the month to cover other essentials like food and medical care. The neighborhood where a person lives also matters for their economic mobility. And this is because high poverty neighborhoods tend to have fewer opportunities, such as high quality schools, for residents to move up the economic ladder. Education can be another factor that influences both health and income. Higher educational attainment is associated with higher income and better health. And this slide shows that in 2015, people with less than a high school education experience chronic conditions at a much higher rate than people who were college graduates. Similarly, when we look at income, in 2015, almost 30% of Ohioans with less than a high school degree had incomes below the poverty level, compared to just 4% of Ohioans with a bachelor's degree or higher. But research indicates that a high school education will not be sufficient for most Ohioans as the economy continues to change. Estimates, as are displayed on the slide here, project that by 2020, about 64% of jobs in Ohio will require some type of post-secondary education. But only about 43% of working age Ohioans have a post-secondary certificate or above. The Ohio Department of Education has set a goal to increase the number of Ohioans with high value post-secondary credentials to 65% by 2025 to help meet this demand. Finally, long-term exposure to stress, particularly long-term exposure to stress without the resources or the coping mechanisms to manage it, can negatively affect both health and income. Long-term exposure to stress is associated with several health problems, including preterm birth and poor mental health. And toxic and persistent stress is also associated with negative health behaviors like smoking and excessive drinking. Research on adverse childhood experiences, which is one type of one type of toxic and persistent stress, has found that children that are exposed to many stressful events and environments in childhood are more likely to be unemployed and to live with chronic conditions as adults. The connections between income and health brief highlighted several options that policymakers and other stakeholders can consider to influence the income and health of Ohioans. 3 areas of particular focus in the brief were tax credits, including the Earned Income Tax Credit, government programs for people with low incomes like food stamps and TANF, and then workforce development and training activities. Guest speakers on today's webinar are going to talk more about these policy areas and tell us about current initiatives to implement policy changes in those areas. But before we get to our guest speakers, I just want to hand things back over to Nick and see if we have any questions.
All right, looks like we have, it looks like we're not having any questions now. So if anybody has any during our other presentations, we'll be happy to answer questions at the end. We did get one quick kind of housekeeping question about getting copies of the slides, and we will be posting those on our website later this afternoon, as well as a recording of today's webinar.
Great, so now we will hand it off to our next guest speaker, who is Michael Evans from the Governor's Office of Workforce Transformation.
Thank you, Zach, and good morning. I'm excited to be on the webinar today. So jumping right in, I'm trying to, there we go. Thank you. So jumping right in, Governor Kasich created our office in 2012, recognizing the importance of workforce for Ohio. Let's back up one. There we go. Sorry about that. Recognizing the importance of workforce for Ohio and how workforce programs have historically been fragmented at the state level. The mission of our office is to grow Ohio's economy by developing a skilled and productive workforce, promoting effective training programs, and connecting Ohio employers with qualified workers. The role of our office is to work with the 13 state agencies and roughly 100 different programs that touch workforce to get everyone moving in the same direction. And one way we try to do that is by aligning training and education to jobs that are in demand now and will be in demand in the future. Businesses create the jobs, so it's important from a public policy perspective that we align education and training to the needs of business. The work of our office is guided by the Governor's Executive Workforce Board, which is comprised of leaders from business, education, nonprofits, skilled trade, unions, and state legislators. And our office works with the board to set the strategic direction for workforce for the state of Ohio. Governor Kasich is passionate about this issue for a few reasons. First, he wants businesses to thrive in Ohio. And to do that, you have to have a skilled and productive workforce to compete in today's global economy. Second, he wants individuals to rise to his or her God-given potential, and a way you can do that is with a good job. The best anti-poverty program is a job, and that is underscored by the description of the webinar and some of the facts that Zach just went through. More than a century of research has found that strong connections between income and health. As a group, people with higher incomes live longer and experience better mental and physical health outcomes than people with lower incomes. So this is just one of many reasons why a job is so important. So a few macro level observations to provide a backdrop about Ohio's workforce. We have a lot of positive momentum in the state. Since 2011, over 471,000 new private sector jobs have been created. And when you look at the labor pool, meaning the number of people who are actively seeking employment, we are seeing growth. And as of this morning, there were over 185,000 jobs available on OhioNeedsJobs.com, with 94,000 of those that pay over $50,000 or more. But I would also say we have some challenges. When you look at the demographics across the state, population growth in Ohio has been relatively flat going back 40 to 50 years. And we are also seeing a geographical mismatch, meaning where the jobs are and where the people are, there's a disparity. And when you look at automation and technology and how that is going to continue to impact the jobs and the skills that you need for those jobs, that is definitely a challenge that we cannot lose sight of. Technological advances have historically disrupted and transformed the workforce. Just think about how technology has transformed and automated repetitive manual jobs, such as the assembly line over time. We're also now seeing artificial intelligence used in repetitive cognitive job functions. So think about call centers. Artificial intelligence can now perform the same functions as a call center operator, but can do it much more efficiently and in multiple languages. Software is also available that can perform non-repetitive manual job functions. Law firms are using machine learning technology that scans documents and creates legal briefs in just minutes, a task that used to take paralegals much longer to complete. So technology is a force that will continue to change the world of work at an increased pace, and that's a good thing. It's not all doom and gloom because many more jobs will be created. Humans are still better at the non-repetitive cognitive jobs involving social IQ, collaboration, and creativity. The data trends indicate that this is the area of the most job growth, job stability, and also the greatest future opportunities. Examples of jobs in this area include STEM, healthcare, research, managerial, and professional office jobs as just a few examples. But these jobs also require a higher degree of cognitive skills and continual learning. Think about this for a second. According to a recent report by the U.S. Department of Labor, 65% of today's school children will eventually be employed in jobs that have yet to be created. Career journeys will continue to change as well. People used to go to school for a defined period of time, get a job, work their way up the career ladder, then retire with a gold watch and a pension. Today's reality is that people will move in and out of jobs more frequently and must pursue short-term training to hone their skills to stay relevant in the marketplace. So here's the bottom line. The skills demanded for workers are changing. To succeed and remain competitive in the current and future workforce, students and job seekers must pursue continuous learning opportunities. So with all that said, I wanted to highlight one initiative our office is leading to try and meet some of these challenges head on, In-Demand Jobs Week. The governor frequently states that we need to capture the imagination and excitement of our young people. And In-Demand Jobs Week, which will take place May 7th through 11th this year, is a statewide celebration of jobs, industries, and skills, and is one way we can excite young people about the world of work. Communities statewide are partnering and planning events that will create awareness of local and regional in-demand jobs among students, job seekers, and parents. A few examples of some of these events currently posted on the Ohio's In-Demand Jobs Week Facebook page are job fairs, business tours, open houses, classroom speakers, and mentorships. So now I have a call of action to all of you and your organizations. Please get involved. Partner with your local stakeholders, local businesses, schools, chambers of commerce, and host an event. We have implementation guides that we've created, and they're available on the OhioNeedsJobs.com website. And just click on the In-Demand Jobs Week icon. And as you plan these events, please upload them on Facebook. I'm happy to provide any information offline as well. With that, I'll turn it back over to Zach.
Thank you, Michael. And next we'll go on to our next guest speaker, who is Kalitha Williams from Policy Matters, Ohio.
Great. Thank you. And thank you for the opportunity to present today. I don't see where I can advance the slide. So can someone just advance the next slide, please? Great. Thank you for this opportunity to present today. I'm with Policy Matters Ohio, and we are a nonprofit policy research institute. We work to create a more vibrant, equitable, sustainable, and inclusive Ohio through research, strategic communication, coalition building, and policy advocacy. In short, we create an economy that works for everyone. Today I'm going to share a policy proposal that we are very interested and excited in advancing in Ohio, the Earned Income Tax Credit. The Earned Income Tax Credit is the nation's most powerful anti-poverty program and has traditionally had bipartisan support. Annually, it lifts 7 million Americans out of poverty. Ohioans have also reaped the benefits from this program. In 2016, nearly 1 million Ohioans claimed the federal EITC, and it helped over 265,000 of them earn their way out of poverty. The federal EITC works by applying a credit to an eligible family's tax liability. If the credit is more than a family owes in taxes, they receive the difference in a cash refund. For instance, if a family owed $50 in taxes and their EITC was $150, that family would receive $100 in a refund. The refundability portion of the EITC is what makes the credit so impactful for working families. The EITC rewards work, boosts incomes, and infuses local economies. Only families with at least one worker can claim the credit. Families use the refunds to buy groceries, make car and home repairs, pay child expenses, and generally pay their bills. Each year, over $2 billion returns to Ohioans that claim the credit. These families use their refunds to purchase goods and services in their local communities. Can someone advance to the next slide, please? And so research, including the research from HPIO that Zach just highlighted, has shown that families that claim the federal EITC have a better quality of life and better health outcomes. Mothers that get the federal EITC obtain better maternity care, are able to buy food that is more nutritious, and are less likely to smoke and have less financial distress. In turn, their children have higher birth weights, do better in school, have higher college attendance rates, and work more hours as adults. Next slide, please. And so, recognizing the important benefits of the federal EITC, many states introduced their own. From this map, you can see that most states have their own EITC. And that's actually 29 states, including the District of Columbia. In 2013, Ohio implemented a state EITC, and it was expanded in 2014. Unfortunately, the Ohio credit is one of the weakest in the nation. As you can see from this map, most state EITCs are refundable, and those are the states covered in blue. Unfortunately, the Ohio credit is non-refundable. In the example I gave earlier, the difference between the family's taxes owed and their EITC amounted to a $100 refund. Unfortunately, because Ohio's EITC is non-refundable, that $100 would be lost and would not return to the family. According to our research, only 8% of Ohio's poorest working families received any benefit from our state credit. Refundability matters. We continue to engage our allies to advocate for an Ohio refundable credit. Each budget cycle to contrast state tax cut proposals that have given billions to corporations and the wealthy. We have released research and engaged policymakers on how a refundable state EITC would help Ohio families. Currently, there is a bill to make the credit refundable, and it has had a couple hearings. Advocates that serve low and moderate income families and children have offered testimony to promote a refundable EITC as a way to help their clients. As we prepare for the next budget cycle, we welcome new allies to engage in this effort. We need the voices of other organizations to tell policymakers that a refundable earned income tax credit is important to helping working families in our state.
All right, thank you very much, Kalitha. And now we will move on to Greg Lawson from the Buckeye Institute, who's going to be talking to us about some occupational licensing reform.
Yes, thank you very much. I'm glad to be participating in this, and I really do appreciate that opportunity. I work with the Buckeye Institute. I'm a research fellow there. We are a free market think tank here in Ohio. And obviously, we really want to allow as much as possible the markets to operate, because we think that's how you're going to create the most opportunities for the largest number of people. Obviously, job creation is something that is of intense importance to us. I think the challenge of Ohio, some of the numbers that we've been seeing in some of the previous presentations, I think are very sobering. I think that past numbers in Ohio in terms of jobs is challenging. We lost more private sector jobs than any any state in the country except Michigan between 2000 and 2010. We've obviously gained some of those back, although the distribution of a lot of those jobs is a little bit lumpy. Central Ohio is very strong. Some of the suburbs north of Cincinnati is very strong. But I think, as you saw in one of the previous maps, there's real challenges there. And of course, the incomes have been challenged and everything else. So jobs to us is really the number one issue. It's the opportunity to create jobs and good paying jobs over time that's going to be able to create the ability for folks to climb the ladder of economic success as time goes on. I think important to understand that we have to move beyond just, always four-year degrees. I think a lot of what we heard from the governor's workforce transformation is important. Apprenticeships, certifications, things like that are important. But an area that we've been really looking at is occupational licensing. And we characterize occupational licenses as permission slip policies. And every state has these. Some states have many more than others. Ohio, in terms of the raw number of different types of occupations. I mean, again, a license is essentially, you cannot do whatever that job is unless you have a license. That's why we call it permission slip policies. You have to get the government permission to allow you to work in that particular area. We expect that for things like physicians and probably engineers who are designing bridges or buildings that have a massive public safety implications. But when you start looking at some of the other types of positions that are out there that are subject to licensing, and not just that they may have a license, but what are the number of hours that an individual must have of training? What are the education requirements that individual has? How long do those requirements require an individual to not be able to reach their full potential and be employed or make the total amount of income that we would expect them to have? That's where we see a lot of the problems with licensing, and so it's really disproportionately impactful for folks at the lower end of the economic spectrum, the people who we need to really be lifting up. And if you look at the unemployment rates for young folks, and if you look at the unemployment rates for young African Americans, they're almost 3 times as large as they are for white Americans, and that applies in Ohio as well. So we need to be able to relieve a lot of these pressures by looking at, is a license really necessary? Does it really mean that it is protecting a real, is there really a public safety implication here? A lot of times licenses, people always say that, hey, licenses are important for safety, or they're important to avoid quote unquote fly by night type individuals like contractors or companies and things like that. But I think a lot of times, unfortunately, licensing is also anti-competitive. And in a free market, that's not what you want. You want to be able to have a low barrier to entry so that there's competition, because competition yields better prices over time and better service at better prices. And it's the same way when you're looking at these jobs. So when you have licenses, it automatically raises the bar to entry and raises the cost of those services to consumers, and raises the challenge of getting new people into the market. So it tends to protect the already entrenched folks, and again, keep new potential entrants out. So we want to see a real kind of streamlining and rolling back of many of these things, because it will help the labor market. And this is not just something that the Buckeye Institute is doing. I mean, it has a wide recognition across the political spectrum, because, of course, we support the notion of rolling these back. The Heritage Foundation of Washington supports it, but the Brookings Institute, certainly not a conservative organization, has issued an awful lot of research that validates this. And I think what's particularly important is that you have the Obama administration was very supportive of this. They actually issued a report out of the Obama White House that really looked at this and said, we need to be considering rolling this back. And the same thing has also been true with the Trump administration. In fact, the Secretary of both the Federal Trade Commission and the Secretary of Labor under President Trump have made it very clear that they want to roll back unnecessary licenses, which have just are reducing the number of jobs that are available, and thus the ability for people to gain incomes and to move up. So there's a number of different pieces of legislation at the State House that are working to address this issue. I think some of the most comprehensive ones, I think it's House Bill 289, and I know Senate Bill 255 are kind of comprehensive approaches to licensing, so that it creates a systemic framework for reviewing existing licenses, and creates also a process for analyzing new legislation that might appear that would apply an occupational license to a new profession that doesn't currently have it. And really what the goal is, it creates a new definition for least restrictive regulation, which is sort of a wonky way of basically saying, we're going to look at this and say, if we're going to displace full competition and we're going to intervene in the market, we should only do so under situations where there is, again, a clear public safety rationale, and two, if there is going to be intervention, there are a series of interventions that are less cumbersome than a full-blown license. Because again, a full-blown license means if you don't have it, you literally cannot do that job. But there are a wide range of other alternatives. You've got bonding, you've got the Consumer Sales Practice Act that is available for individuals. You also have private certifications. You have registration, which you may have to submit your information to the state, but you wouldn't necessarily need a license from the state in order to work. There's a whole host of things that you can do. It's not an either you license or do nothing. There's a range of policy options that are available. But I think we want there to be the predisposition from state policymakers to not always go from 0 to 100, so to speak, and to always say that if there's something that we need to be doing, it has to be this license.
Hello?
And so that to us is the critical thing, is to look at how do we really look at, I mean, Ohio, for example, let me give you just one example of what this could mean. Ohio was the only state in the country that had a salon manager's license up until the previous General Assembly. In other words, you would get your 1,500 hours. of education to become a licensed cosmetologist. And this was actually obviously very impactful for women and very impactful for minority women as well. They literally couldn't have be an on-staff manager unless they had this additional license. That was an additional 300 hours. And if they didn't get it through a tech center while they were in high school, they were probably going to a private education organization, which is fine, except that that's thousands upon thousands of dollars. And that was another 300 hours that they had to get that added to the debt situation for those individuals and didn't. And again, this was above and beyond their cosmetology license. And I don't think that we require people who run restaurants and be our managers on duty at restaurants. We don't require them to have a separate license, but we were requiring a separate license to run a salon. It was a ridiculous requirement that, again, didn't exist in other states, any other state. It was finally repealed, again, in the last General Assembly. But that is an example of those kind of overburdensome regulations that make it difficult for people to move into the higher positions. And if they want to move into those positions, then they have to basically kind of pay the piper, so to speak. We need to be able to get people employed quickly. And the best way to do that is to not gum things up with a bunch of red tape and occupational licenses. In many cases, not all, but in many, are not really about public safety. They really are about keeping people out of the market so that the already entrenched folks have power to set prices and things like that. So we need to be rolling that back. Sorry, that was the end of what I was going to initially say, and I guess we're going to questions.
All right, thank you, Greg, and to all of our panelists. We are going to be moving into questions, so if you have any questions, please start typing those into the chat box. But before we do that, we wanted to throw up a very quick poll question to kind of get a little bit of feedback on how the webinar has gone. We're always trying to look for ways to improve our webinars as we move forward. So if you could take a quick second once we get that poll up, to go ahead and answer that. And as I mentioned earlier, we'll also be sending out a very brief survey later today in an email. Any feedback you can give us would be greatly appreciated. And as you're answering that, I wanted to give the panelists a heads up as well that we will be unmuting all of the panelists. And as I kind of go through the questions, please feel free to speak up if you have comments on the question. All right. Thank you for taking that poll. And I think we'll go ahead and move on to questions. And the first one I have here is specifically for Michael. To what extent is your office's focus on focused on living wage jobs, given the previous discussion about and research about connecting wealth and health? So Michael, if you could kind of comment on that briefly.
Yeah, absolutely. Thanks for the question. So yes, we're very focused on that. We have what's called Ohio's in-demand jobs list, and so to meet the criteria, a job has to pay $13.47 an hour. So essentially $28,000 a year. And what we do is we go out every 2 years and we survey the business community. We combine their answers with some of the job labor projections from the LMI office, and then we compose our list. So we currently have over 200 jobs that are on the in-demand jobs list. And like I said in my remarks, we are really trying to align all of our education and training to those jobs. And we're actually going back out into the field again this August to survey around 3,000 Ohio businesses to see what those living wage jobs are.
Great, thanks a lot. The next question from somebody in the audience is, what efforts are currently underway to reduce legal barriers to employment? And an example they give is reducing certain nonviolent crimes to misdemeanors. Felonies and other criminal charges present a significant employability disparity for Black Ohioans seeking jobs. So again, that's open to all three of you if you have any kind of thoughts or comments about those barriers to employment.
Yeah, this is Michael. I can answer that one as well. So in the budget, we had an initiative that deals with what are called certificates of qualification for employment. And so essentially what these are, it's more like a reference letter that's issued by a judge that rolls back and provides cover to businesses for negligent hiring if an individual has a felony or a misdemeanor and they don't disclose it. So at the end of the day, it's basically a reference letter from a judge saying, hey, this individual is ready to work. So there was previously a wait list or a wait time. If you have a misdemeanor, you had to wait 6 months till you're eligible for this, or you had to wait a year if you had a felony. So we have rolled that back, and individuals are now eligible to apply for these certificate of qualifications for employment issued by the judges. And that can serve as a really a leg up for those folks coming out of incarceration to connect back to the job market and be able to state that they're ready for work.
Great. And I believe I heard Greg. Were you interested in commenting as well?
Yes, I was actually going to mention that, so I was glad that Michael already mentioned those. And I think there's a number of other things too. There's a number of criminal justice reform efforts that are going on. There was a criminal justice recodification committee that met. There was a very large committee comprised of judges, prosecutors, legislators, a wide range of groups. We actually have a criminal justice fellow at the Buckeye Institute who participated in a lot of that as well. I don't know that and some of the discussion of reducing some of the crimes, quite frankly, low-level felonies maybe being shifted into the misdemeanor range. That is certainly something that is on, I think, the agenda. It's a difficult issue at the State House. It's kind of controversial, and there's a lot of entrenched, opposition, but there's also a lot of folks who are in favor of that. We actually at the Buckeye Institute are generally very favorable for that relative to the nonviolent type offenses, especially with drugs or drug use offenses, not necessarily trafficking. I think that's a separate issue that has to be addressed, especially with the opioid crisis here in Ohio. But for those that have been utilizing it, to make that be a long time kind of scarlet letter that it prevents people from working is not moral, and it doesn't make any sense from a financial standpoint from the state either. I think there's also some ideas that we've been percolating. There's not legislation right now, but we think that a lot of times folks aren't aware that maybe they're prevented from getting we're talking about licensing, getting a license in a field that they want to do because of whatever the nature of their crime was. We'd like to actually offer a little more flexibility to the licensing boards and allow individuals to pre-petition before they go to do some sort of a training course and something to get a license. There's no point in somebody going and doing that and then being told by a licensing board that you can't do it. So it's sort of picking up a little bit on what Michael was talking about, and maybe even trying to make it even a little bit broader and a little bit, I think it's a very good policy what we have in place, but to make it even a little bit broader and more useful even too, than even that is. So trying to build upon those successes, but that's an imperative issue to be able to bring down barriers, because those are some of the most egregious barriers that there are for folks.
Great.
I'd like to weigh in as well. One of our allies, actually two of our allies, the Ohio Organizing Collaborative and the Ohio Justice and Policy Center, are currently engaged in collecting signatures for what they're calling the Safe and Healthy Ohio campaign. And that work is focused on actually quite a few things, but it includes reclassifying nonviolent offenders that are maybe charged under drug crimes to be reclassified from felonies to misdemeanors, and also includes disrupting the probation to prison pipeline. And that information is actually available on their website, the Ohio Organizing Collaborative.
And I believe Michael may have a few more thoughts to add.
Yeah, I'd just like to add a couple more comments quickly. So our office, we work with Director Moore and his team quite a bit. And so they have an office within Rehabilitation and Corrections called the Office of Enterprise Development. And this group, they go out and they partner with businesses. And we are seeing a lot of businesses that are actually coming through. They have to go through an approval process, but they're actually working the institutions, and they're either partnering on site in an institution with inmates and providing them training for their type of work, or they're actually having some of the folks that are in the system coming out to their actual employer's headquarters. So one of the State of the State events, it was a fantastic event. Union Supply, they are located in Groveport, and they have a crew of about 20 inmates that come every day, and they work full time. And they are hiring these folks right as they come out of incarceration. So that's one area I wanted to highlight. And also, we work really closely with some of the other champions, such as Hot Chicken Takeover, on this work. So we are absolutely all about trying to lift barriers and raise these people up so they can have some gainful employment.
Great. Thanks to all three of you for those comments. Just a couple of quick questions before we wrap things up. The first one is specifically to Greg. Does the Buckeye Institute have a specific list of licenses that should not be required?
We're actually in the process of putting together that. I will say, for example, I mean, this might not be as applicable to some of the folks in the audience, but we license auctioneers, for example. It's kind of a weird one. But I'll give you another example. We have, I believe, close to double. This isn't necessarily eliminating a license, but it would be something where we might want to look at the number of hours and make it more in line with the national average. We have HVAC, heating and ventilation, obviously installers, which can be relatively good paying, kind of, obviously it's a skilled trade type position. And I believe, off the top of my head, I don't remember the number of hours, but I recollect that it was, I think, close to double like the national average in terms of the hours and stuff you had to do prior to being able to go out and do your own thing with that. So that's one where we might want to consider dropping it down in terms of the number of hours. And also there's legislation right now at the State House. It's turned out to be a little more controversial than I would have expected. But cosmetologists, and we talked about the salon manager license before, but there's a legislation that would reduce the number of hours from 1,500 to 1,000 hours, which is consistent with, for example, the state of New York. So New York cosmetologists require 1,000 hours. We require 500 additional hours above that. I'm not sure. I think that New York, I've heard a whole lot of stories of New York's cosmetology industry being a massive public safety issue. So it raises the question of that. So we want to reduce those hours as well. And we've been involved with it. There's a coalition that's involved in that. And so those are a couple of examples of reducing the burden, even if it's not outright getting rid of a license.
Great, thank you. And then the final question we have before we kind of wrap things up, is there anything we can do to help promote the EITC for Ohio?
Absolutely. We need, as I stated earlier, we need more allies and partners to come forward and talk about how the EITC would help their community, would help their clients. We have a great dearth of research that we release in Ohio. There are some legislators that are supportive of it, but we really need partners and more allies and people to help us make the case for legislators that this policy is impactful to the people that they serve. It is a program that incentivizes work, extremely targeted, has all these tremendous outcomes. And unfortunately, Ohio is being left behind with the majority of the other states that already have refundable credits. So please, reach out to me if you'd like to engage in the work and be a part of the effort to making our state EITC refundable. We'd love to have you in our coalition and at the table.
All right, and I think we will leave it there. Thanks once again to our panelists and to the audience for taking the time to listen today. As a quick reminder, you can download our Connections Between Income and Health policy brief at the link listed below on our website. We'll also be posting the slides and a recording of today's webinar on our website later today. Thanks a lot. Have a great rest of your day and a great weekend.